want to tell you a little bit about our partnership because I think this will give you a feel for what we offer and why we are able to do what we've been able to do for so many years and do it really with such harmony amongst the three of us. So we, the three of us, Dr. Blanchard, Washi, myself, trained at William Beaumont Hospital in the family practice residency. This was almost 20 years ago, guys. So yeah, that's a long time. But we met actually as bright physicians who wanted to train in family medicine and go out and save the world and cure everyone, right? And so we built our practice, and it was a nice practice that we built in Clarkston, Michigan. And our goal, again, was to try to provide a very unique model of care for patients so that patients who came in really felt like I'm an individual, okay? The doctor knows me. The doctor knows me intimately, knows my family in many cases, really cares about me, has the time to take to really make sure that whatever I need to have addressed, he or she can handle it. So that's what our motto was. But again, as we built the practice, one of the things the naive doctors figured out is the busier the practice gets, the more strain on the time, right? So as we were seeing more patients, the volume actually began to increase. And we figured out that, yes, there's going to be a delicate balance that will be necessary if we continue to expand the practice there. Well, the other thing that we didn't have so much insight in is these extra forces, okay? These forces outside of our control on a national level that really can get intrusive and interrupt the relationship between the doctor and the patient. We didn't really have a sense of what that looked like until we got into the milieu, so to speak. But we figured out eventually that that system was going to suffocate us. Okay? It was going to actually create a lot of disharmony in our own lives and certainly put strain on our ability to really provide that level of care that we wanted to provide for each individual patient. So we began to look and we said, we've got to do something that actually is novel and creative and maybe a little bit out of the box. And certainly at the time that we were thinking to do this, there was no other practice that we could look at in the state of Michigan that was doing this level of care, the type of care that we are going to talk to you about tonight. So we looked out west and we saw some practices out west that were doing what was called at that time concierge care, concierge medicine. And we looked at them and we found out that there was something really almost miraculous that was happening. They were able to go back and reclaim those relationships that we hungered for, the relationships that we felt being stripped away as our lives were getting busy and as the volumes of our patients and the demands of the insurance companies were stacking on. They were able to go back because they were limiting their patient pool sizes, and they were actually having a relationship between the patient and the physician that allowed them to scale down and deliver that level of care. The outcomes were dramatically improved. The patient satisfaction scores were high. The physicians loved their practice. And so we made a decision at that time to actually say we need to consider this model here in Michigan. Even though there's no one else doing it, if we're going to continue to practice medicine and love what we do and be passionate every morning to come in and say, I am excited about my day to be able to help folks, we've got to make a change in our practice model. And so that's what we did. And we grew that practice. We've been growing that practice now for over 10 years, delivering that care, and it's really doing very well, the practice. It's gaining traction. Word of mouth from many of our patients has helped us to build that practice into a very well-respected practice in the state of Michigan, and we're actually gaining some national attention as well. We were actually the first direct primary care practice in the state of Michigan. And we actually pride ourselves on the fact that we remain a truly direct primary care practice because we don't bill insurances in addition to the fees that our patients pay us for their care. So we truly have kept that as preservation. But our patients love us, okay? And I don't say that to brag. I just say that as a statement of fact. Our patients love us. And they love us because they know that we are intimately concerned about keeping their health at a premium, optimizing their health care, making sure that their issues are completely addressed at the time of visit. And as the doctor mentioned, keying in on access. because if access is inhibited, there's going to be a decline in satisfaction. There's no way around that. So we've opened up access, and patients have an unrivaled access to the doctor, and so we've been able to do that. But what's happening, unfortunately, and Dr. Blanchard is going to talk to us a little bit about this, is as we're doing this model, there's actually problems on the landscape of medicine and healthcare on a national level, and it's actually present here in our state as well. It is impacting the doctor's ability to care for the patients. And you're seeing that, if you haven't already, stay tuned, you will see this actually become very intrusive in the relationship that you have currently with your primary care provider. You'll see it come in, it's leaching in, and it's actually stripping away and declining the quality of care that you're so accustomed to see and receive. So that's happening now, and that's sad. But we have solutions, okay? And the solution that we're going to talk about, my partner Dr. Washi is going to follow Dr. Blanchard to talk about that. But we have a solution that we have seen as a viable option for that model of care that's becoming deteriorated, that's actually not servicing you as patients very well. So you'll hear that as well. But as Dr. Blanchard comes, he's going to tell us what's going on a national level, and he's absolutely able to do that because Dr. Blanchard has been watching this issue and watching the change on a national level for years, and actually was intimately involved in a lot of the legislature that we mentioned early on with Senator Colbeck that actually got that legislation passed. Dr. Blanchard was involved in that, and he still has his pulse on what's happening on a national level to protect this model of care, because we don't want this stripped away. We don't want this freedom, and I forgot to mention this, by the way, forgive this. If there's any veterans here, thank you, okay? Thank you so much for your service. I meant to mention that earlier, but we're very appreciative of your service. But the freedoms that our veterans actually gave to us, and I don't want to turn this into that speech, I could very easily do that, and I think I have a friendly crowd here tonight, but the freedoms that we enjoy, we must protect. And we must hold on to them. We must fight for them. And a lot of what we're doing in terms of our initiatives on a national and local level are to try to protect that right of the doctor and the patient to determine what's best for them, and not have someone else who's outside of that equation actually come in and drive that decision. So thank you. So we're fighting hard for you, and again, this is not a selfish motive. We enjoy what we do.